friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you. Welcome back to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, physical therapist and owner of Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and now even El Dorado, Arkansas. If you've been watching over the past couple of weeks, we've had a special guest, Dr. Rachel Atkins, and a couple of weeks ago she talked to you about stress incontinence, and last week she talked to you about urgency incontinence. So we have this series of 3 on pelvic floor impairments, which Dr. Rachel Atkins is our specialist here at Physical, and today she's going to be talking to you about postpartum pelvic floor pain.
That's correct. And typically after you've delivered a baby vaginally, you may have pain in this area called the perineum between the vagina and the anus, if you look at the bottom of the pelvis or the pelvic floor. This pain is normal up to about 6 months after vaginal delivery. And so if you continue to find yourself having pain in this area after 6 months of delivering a baby, that is not normal and needs to be addressed with some exercises that we will go into today, and also likely with your OB and hopefully a physical therapist that can help you with pain. You may have some scar tissue in that area from traumas that occur during childbirth, and when that scar tissue forms, the layers of tissue adhere to each other and don't move well, and so that can cause pain with intercourse or even pressure when sitting in a chair or sitting in your car, etc. So if you find yourself having pain or tightness in the perineum, that needs to be addressed with some exercises, and I'll go into those here briefly. Also, if you've had a cesarean section, you likely have scar tissue there as well and possibly pain, and we can also give you some helpful tips for managing that pain and scar tissue as well. So join us in this next segment to find out what to do about this pain and scar tissue.
Awesome. Before we leave, Dr. Rachel, I have one quick question. You said that the pelvic floor pain may be normal up to 6 months after having a child.
Right.
At what point, if someone is having pain there, at what point would they want to seek out help from a skilled therapist like you?
Right.
Would they need to wait that 6 months, or could they come earlier?
They can definitely come earlier, most definitely. But it can be normal to experience pain there for up to 6 months after delivering a baby.
Okay. So, but if they came to therapy, then that could help resolve that pain a lot quicker, right?
The sooner you come, the better, for sure.
All right, awesome. Well, thank you so much. And y'all come back in the next segment. Dr. Rachel Atkins is with us today, and she's going to show you things that you can start doing immediately to help you resolve your pain and get back to loving your life. Thanks. Welcome back to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, owner of Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and now even El Dorado, Arkansas. If you were with us in our previous segment, you already met Dr. Rachel Atkins. She is one of our staff therapists and a specialist in pelvic floor impairments. Today she's specifically talking about postpartum pelvic floor pain. So turn it over to you.
That's correct. We're talking about pain in the pelvic floor in a specific area called the perineum, and it's down here at the bottom of the pelvis in between the vagina and the anus. This area here is susceptible to trauma during a vaginal delivery. And so if you find yourself having pain in your pelvic floor after delivering a child, I'd like to share some tips with you on how to improve that pain and function of your pelvic floor. The first tip is scar tissue massage. Now, this scar tissue massage can also be helpful if you've had a cesarean section. You can apply these same techniques to the C-section scar. But what I'd like to do is remind you to be sure that the scar is present and well healed, and typically that's about 6 weeks after delivery, and you will have a follow-up with your OB at that point. So once you know that the healing is done, you can then perform scar tissue massage using 3 different techniques. And you'll want to use an oil that you know works well for your skin, such as sweet almond oil or a vitamin E oil. There are 3 scar tissue massage techniques. You can go across the scar, perpendicular to it. You can go parallel with the scar, up and down, and you can go circular on the scar, clockwise and counterclockwise. And so what I would recommend is that you take a warm bath or a shower, and you can even do this massage in the bath or the shower. Make sure that you're relaxed, because those muscles need to be relaxed, and then massage for 5 to 10 minutes on those scars, and do this daily. The second tip that I'd like to share with you for decreasing pain in the pelvic floor is Kegel exercises. And these can be done immediately after childbirth to help improve blood flow to the area and help the tissues to come back together. And most people actually don't perform a Kegel exercise properly. When they do, try one. And so we'd love to help you here at Fyzical make sure that you are properly performing a Kegel exercise. But the essence of a Kegel is to squeeze together and lift the muscles in the pelvic floor, like you're trying to prevent gas from escaping or trying to stop the flow of urine. That's the sensation of squeezing and lifting. And you can hold for 5 to 10 seconds on those Kegel exercises and increase that to improve your endurance over time. So, scar tissue massage, Kegel exercises can really go a long way in helping to decrease that pain after vaginal childbirth and the scar with C-section as well.
Cool, thank you. That's great information. I want to step back just a minute on the massage, on the scar massage.
Right.
Now, how do you properly perform that? Do you just like rub on the scar itself, or do you apply pressure to the soft tissue below it and move your fingers like that?
Yes, it is a little bit deeper. And one thing I want to make sure you know is that it shouldn't be painful. So on a 0 to 10 scale, where 10 is emergency room pain and 0 is no pain, we want it at about a 2. And also, if it feels slightly uncomfortable while you're massaging, that's okay as long as the pain's not more than a 2, and as long as it dissipates within about 1 minute to 5 minutes after the massage. You should feel back to your baseline feeling. So you do want to apply enough pressure to move that scar, but not so much that it's painful.
Okay, yeah, thank you. That's great.
Sure.
Great information, Dr.
Good.
Rachel.
I hope it's
I
helpful.
really appreciate you joining us this past 3 weeks here on Therapy Thursdays. Again, I'm Dr. Jerry Yarborough. I'm the owner of Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana. So come and see us and we'll help you get back to loving your life.